Tell me a little bit about the work that Merck does around the world. I know that Botswana is one of the countries that you have excelled at addressing the Access to Care program.
So Merck has tried to implement a comprehensive program to address HIV in the developing world, including differential pricing and medical education, research. But in a few countries we've adopted and put in place in partnership with other stakeholders focused programs, and one of these is in Botswana, where in 2000, with the help of the Gates Foundation and in collaboration with Gates and the government of Botswana, we instituted the Africa Comprehensive HIV/AIDS Partnership, which addresses prevention, treatment, care, and capacity building to address what in Botswana was one of and is one of the greatest HIV problems that any one country faces. It's been an amazing success where we've gone basically from almost no one getting treatment when the program started in 2000 to really having almost reached universal coverage in Botswana of upwards of 80%. So it's really been a remarkable program.
You've been working in HIV for how many years?
I started working in HIV in 1989.
As someone who's worked in the field all those years and through the majority of the pandemic, because you've been around the world, what's your feeling on where we are now? I mean, people are talking about the end of AIDS and AIDS-free generation. We've got a long way to go to make those things realities, but the science says it's possible. What is your feeling? Can we end AIDS?
Well, I think right now is a very exciting time for AIDS. It's certainly a time of challenge. We have challenge in funding here in the US. We have challenges of funding in the developing world. But it's also a time that we can look back in the developed world on the past 25 years, in the developing world on the past 10 years, and look at the success of getting so many more people on treatment than I think we thought possible. We need renewed emphasis on the disease within the US. We need renewed emphasis on funding. We need renewed emphasis on the scientific challenges that we have to potentially get to this point of eradication, of cure.